Welcome back. I'm here with Anne Mills. She's from the London School of Hygiene and Tropical Medicine. Thanks so much for joining me today.
It's a pleasure.
So we're talking about resilient and responsive healthcare systems. What do you think are the major challenges when it comes to building these resilient and responsive healthcare systems?
So I think the first thing to say is that I think those concepts apply to countries at all levels of development. I don't think it's just a problem of low country health systems that they may not be resilient or responsive. That said, I could choose a whole load of different things, but I think what I might highlight most is what we call human resources, not just the health workers, the doctors or nurses who treat you, but also the managers, the leaders and so on. And I think that's where a lot more focus needs to be placed on how we can support them to cope both with the day-to-day challenges of their job as well as the big things that come along like Ebola or Zika.
Yes, we've talked to a lot of people today about the challenges in the developing world, but it's interesting that you say that in Canada there are some places we can improve. Could you just elaborate on that a little bit?
Well, I was actually thinking of my own country, the UK. We have headlines about the National Health Service every day, about the strains on the National Health Service, on accident and emergency departments. I think one of the things that strikes me most is for countries like Canada and the UK is the critical importance of lining up your health policies and your social care policies. Because we have aging populations, they have complex health needs, they may need medical attention, but they may also need a caring and supportive environment. Certainly in the UK, the problem is our social care services are struggling with lack of money, and the health service gets the fallout from that.
And what actions do you think should be taken to improve the health system in this way?
So what to make a health system more resilient and responsive? Well, again, many actions, but I suppose if I go back to my theme of human resources, it's ensuring that supportive systems are in place for health workers, that managers help them in their day-to-day work, that our health services are linked to the communities that can also support them. And so, many interventions at many different levels, but essentially to support the staff of working in the health service to do their job.
And what questions do you think need a bit more research when it comes to building the resilient and responsive health systems?
So generally this area is neglected in terms of research. So I think we need to look at things like training systems, ways of improving the management of health workers, ways of improving the incentives they're faced, particularly in low-income countries, for example. They may be low paid, not well supervised. So trying different ways of improving the conditions of health workers.
Thank you so much for joining me. It was great.
It's a pleasure.